Good morning. Good morning, everyone. So today we will be discussing about the sleep disorders, and the medical and the surgical management of the sleep disorders. So first of all, we'll begin with the introduction. So why is sleep necessary? Sleep is essential as a restorative process to maintain cognitive performance and work productivity. Although your muscles they will not require sleep, but the brain needs sleep in order to function and control the movement and thoughts, and in order to work at its optimal capacity. So, when we say sleep, we will first be talking about the normal sleep. So, normal sleep is divided into two main categories. The first category is the light sleep, which includes within it the stage 1 and stage 2. And the second category is the deep sleep, which then includes within it stage 3 and stage 4. So, in normal sleep, so, in normal sleep, the third stage that we need to talk about is the REM part of the stage, which is also called as rapid eye movement sleep. So, in the rapid eye movement sleep, the brain is active in consolidating the thoughts, learning, and the memory. Once again, we will repeat that the normal sleep pattern, for which we do polysomnography. So polysomnography is the ideal gold standard test for monitoring the sleep patterns. And in normal sleep, the polysomnography will show you three main stages. We are repeating those stages. First is the light sleep, which includes within it stage 1 and stage 2. Second is the deep sleep, which includes within it the stage 3 and stage 4. And finally, you have the rapid eye movement stage, or the REM part of the sleep, in which the brain is active in consolidating thoughts, learning, and memory in the REM part of the sleep. Another important thing about the REM part of the sleep is that as the night progresses, the REM period starts becoming longer and longer. That is why you feel more refreshed after a longer stage of sleep. In the REM part of the sleep, there is a generalized inhibition of skeletal muscles, including the intercostal, accessory, and pharyngeal dilators, which leaves largely the diaphragm. So, diaphragm is the main muscle that is supporting ventilation during the REM part of the sleep, because the rest of the muscles that are controlling your ventilation process, their movement is inhibited during sleep time. So the role of diaphragm becomes very important, and especially in people suffering from respiratory or neuromuscular disorders, this is the phase of the sleep where they will be feeling most disturbed. So, in these phases, the least adapted system that is least able to adapt to changes in the sleep is your respiratory system. So, because it is least adapting to any changes in sleep, that is why most of the sleep disorders will have to do with being unable to properly breathe during your sleeping time. So, what happens in the respiratory system? First, there is an endogenous circadian rhythm in pulmonary function, respiratory control, and basal metabolism, which is independent of daily changes in behavior and environment. So that is why they say that you have to sleep on time, because if you don't sleep on time, your rhythm of changes in the pulmonary function, respiratory, and basal rhythm, it will continue to go on whether you are sleeping on time or not. Then, secondly, during the night, there are diurnal falls in the cortisol levels and body temperature, and there is an increased cholinergic, sympathetic tone, which can lead to increased airflow limitations in patients with COPD. So, respiratory system is the most important when you are dealing with sleep habits. So, what happens when you are suffering from sleep deprivation? So when you are suffering from sleep deprivation, it will lead to decreased cognitive, psychomotor, and executive function. Also, it will lead to increased cortisol, which can then lead to impaired glucose tolerance. Also, your appetite would be increased due to decreased leptin and ghrelin ratio. That is why, if you are sleep deprived, it can lead to you overeating to compensate. So this is not something out of your control. That is why whenever they're telling you to reduce weight, one of the important tips that they share is that you need to have a good complete sleep in order to reduce your appetite as well. Moving on, we now come to EDS. EDS stands for excessive daytime sleepiness. The most important part in identifying the excessive daytime sleepiness is the ESS score. ESS score is basically your Epworth sleepiness scale, and it is a whole scale where you find out that how sleepy that person is. A score more than 10 is considered to be significant, although lower scores cannot exclude sleepiness, but they might be in due to misinterpretation of the test. So for the excessive daytime sleepiness, you need to remember that the most important test is the Epworth sleepiness scale, and a value greater than 10 is considered to be significant excessive daytime sleepiness. So another important test is the psychomotor vigilance that can be measured. It can be measured using the Oxford Sleep Resistance Test. It is one of another name for this test is called as Osler. Two more very important terms are OSA and UARS. So OSA stands for obstructive sleep apnea. We will be discussing this in detail later on. It is an episode that involves oxygen cessation for more than 10 seconds. And secondly is the upper airway resistance syndrome. It is also known as UARS. And this is increased resistance to breathing during sleep but without the cessation of breathing. So it's the variation of OSA. If there is a cessation of breathing or stopping of breathing, then we call it obstructive sleep apnea. But if there is no cessation, complete stopping of breathing, but there is an increased airway resistance, then we call it UARS or upper airway resistance syndrome, which is just a variation of OSA. Another very important term is the CSA or the central sleep apnea. This is basically recurrent episodes of apnea despite a normal and a patent airway. So this is associated with many different causes, but chief among those causes is the left ventricular cardiac failure with Cheyne-Stokes respiration. So this results in CSA or central sleep apnea. The management of the central sleep apnea involves treating the underlying condition and continuous positive airway pressure and oxygen. Now we come to another very important topic. This is OHS. OHS stands for obesity hypoventilation syndrome. In this, with BMI of greater than 30 kg per meter cube, is the combination of obesity with hypoxia during sleep. And this is hypercapnia or the increased level of carbon dioxide which occurs in these patients. And because of the increased level of the carbon dioxide levels, this is being precipitated. So typical clinical features of these patients who are suffering from obesity related hypoventilation syndrome is that they will have obesity, excessive daytime sleepiness or EDS, and then symptoms of right heart failure, including peripheral edema and cyanosis. So this is because of increased carbon dioxide accumulation in these patients because of obesity. And That is why you have to treat obesity in these patients. So for investigation, there are many different investigations, including keeping a sleep log with you. But the best investigation for sleep apnea and sleep disorders is to get a polysomnography done, or PSG. And the management includes weight loss, lifestyle modifications, which are the first line of management for these sleep disorders. Lifestyle modification can include elevation of the bed head, avoidance of supine posture, avoiding alcohol, tobacco, sedatives, and then lifestyle modifications can help you, if and they can help you even more if you are reducing your weight. So significant weight loss has been associated with a cure rate of up to 10 to 20%. So it's a huge thing, if especially if the person is obese. And then the final thing is the CPAP. CPAP is the treatment of choice, which can enable a person to maintain a patent airway, but it is usually done only after the first two weight loss and lifestyle modifications have failed to alleviate the problem of the patient. Now, finally, we will cover two important things and we will wrap up this chapter and topic. First is the criteria. So, OSA is diagnosed if there is a presence of a positive oximeter result, including excessive daytime sleepiness with an ESS score of greater than 10. We have already discussed its significance. Second is the obesity with the BMI greater than 28 kg per meter cube. And third are the presence of other comorbidities. But once this is done, we have to go for the levels of apneic episodes the patient suffers in a single hour. So an apneic episode is a cessation for more than 10 seconds, and there is no OSA or obstructive sleep apnea if the apneic episodes are less than 5. But if they are 5 or more than 5, then it's a mild OSA. If there are 5 to 15, it's a mild OSA. If it is 15 to 30 apneic episodes per hour, then it's a moderate OSA. And if it is greater than or equal to 30 apneic episodes, then it is severe OSA. Hopefully you enjoyed this episode of discussing it in depth. And if you do like the video, and share the video if you enjoyed it, and we'll be back soon and try to cover all the important ENT topics. Thank you.